Hello, Miss Turtzo. How are you today?
I'm good. How are you?
Remember me? I'm your nurse, Jen. How's it going today?
Pretty good.
Good.
Pretty good.
Okay, so if this patient were in the hospital, I would be checking her wristband, but as this is a home care setting, I already know her. But can you just verify your first and last name for
Sandra
me?
Turtzo.
And what's your date of birth?
11/19/1949.
Okay, and your medical record number is 12345. It
Yes,
all
it is.
looks correct here. Perfect. So how have you been?
I've been all right. I've been a little dizzy.
Oh, okay. Well, first, can I just ask you before I keep going, any allergies?
Not to medicine.
Not to medicine, but what about foods?
No food. Allergies.
No foods?
No.
Any seasonal allergies?
I have hay fever.
Oh, you do? So what do you take for your hay fever?
Prednisone.
Oh, okay. How often do you take your prednisone?
Not that often when I need it during the year. Just a couple of times here and there.
Okay. So when's the last time you took it? You don't?
It was 2 months ago.
Okay. All right. And then any allergies and to like anything like tape or latex?
No.
No? Okay.
No, nothing like
All right.
that.
Well, very good. Well, we're going to perform. So now we're going to assess your level of consciousness and any equipment that you have around you today, okay?
All right.
So just looking at your body, everything looks symmetrical. Can you just sit up for just 1 second to me? Okay. And do you know what day of the week it is today?
I believe it's Sunday.
Yes, it is Sunday. And
I'm
about
happy
what
about
time
that.
is it today?
About 5 o'clock in
That's
the
right.
afternoon.
Have you had dinner yet?
Haven't had dinner.
No? Okay. So the patient is awake, alert, and oriented. She's in no physical signs of distress other than her normal physiological finding of her dyskinesia with her Parkinson's. But otherwise, everything appears normal. Just assess Ms. Turtzo's level of alertness. Now I'm going to assess kind of her environment and if she has any equipment. If she doesn't have any equipment, if she were in the hospital, I would assess, her O2 tubing to make sure it's not causing any abrasions or any issues on her nares. If she had an IV in place, I would be assessing her IV site. I would make sure that her dressing is clean, dry, and intact, that the IV isn't leaking and doesn't have any blood that's coming out of it. I would ask Ms. Turtzo if the IV site was tender to touch, 1 inch to 2 inches around the actual site itself. I would assess for any redness, edema, or any coolness to the skin that's abnormal from the rest of her skin in the area of her IV. And I would also make sure that the infusion that is running is the appropriate infusion and then that the rate matches what's on the physician orders. Okay, Ms. Turtzo, now I'm going to take a look at your hair, skin, and nails, okay? I'm going to check your hair, then I'm going to check your fingers, and then I'm going to look at your feet. Is that okay? All right, so I'll help you sit up. You can grab my hand. I can also be assessing multiple areas while I'm doing this. I can be doing a strength assessment and visualizing, feeling how she pulls up on me. So I'm going to take a look at your hair.
I'm losing my hair.
You're losing it. Are you doing anything to find it again?
No.
No, you're not taking any medications?
No, I'm taking a lot of other medication.
Okay. So I don't see any problems with her scalp. It's all intact. There's no signs of injury or any types of scars. Everything is intact here. Okay, you can go ahead and lay back down. Now I'm going to check your fingers for capillary refill time. So your left hand is less than 3 seconds. Let me see your right hand. It's less than 3 seconds. Okay, can I go ahead and check your feet now? I'll do one at a time.
That's fine.
All right, I'll keep you covered. So your feet, your toes look a little dry. Okay, but there's no scars or any cuts or open abrasions or anything like that. And the refill time on your toes is the same, less than 3 seconds. Okay?
Good.
Okay, Ms. Turtzo, now I'm going to ask you to follow my pen with your eyes, okay? So, if you want to sit up just a little bit. Okay, ready? Follow it with your eyes. Okay, good job. Perfect, very good. Okay, let me see, your pupils are reactive to light, equal, Perla. Okay, I'm going to look in your nose really quickly. Everything looks intact. You don't have any areas of breakdown. There's a little bit of discharge on your left side. I remember you said you had allergies. So I do see a little bit of that. If you want to sit up for a second, I can help you. I'm going to take a look in your ears. Everything looks fine on your ears. There's no evidence of skin breakdown. Sometimes people who stay in bed for a lot while can have breakdown in their ears. I don't see any of that. No discharge in either of them. Okay, all right, now if you can just open up your mouth for me and say ah. Tilt your head back for me and say ah. Okay, looks perfect. Your mucous membranes open up again, are nice and moist. There's no signs of any discoloration or any lesions in her mouth. So that's that. I'm just gonna assess your face for symmetry. If you can sit up for 1 second.
Sure.
Okay, if you can smile for me, please. Okay, if you notice her smile is completely symmetrical. There's no drooping in her eyes or either side of her mouth. Okay, Miss Turtzo, are you having any difficulty breathing or any chest pain since I saw you last? None? Okay, well I'm going to go ahead and listen to your lungs now. Is it okay if I just lift your shirt up a little bit so I can listen directly on your skin? Okay.
Go right ahead.
So I'm going to listen to your lungs in 10 places, okay?
All right.
All right. I'm going to hop up on this bed next to you so I can get a better listen. Okay?
Okay.
All right, so when you feel my stethoscope touch you, I need you to just take a big deep breath, okay?
Okay.
Okay, Ms. Turtzo does not have an incentive spirometer, but if she did have one, I would be explaining to her how to utilize it. I would explain to her that she would blow air into the tubing and try to hold the ball up between the specified areas for 10 seconds, and she would do that numerous times throughout the day. Okay, so now we're gonna do our cardiac assessment. Okay, the first thing that I'm gonna do is I'm gonna just touch your neck. I'm going to feel your carotid pulses, and then I'm going to feel your dorsalis pedis pulse, okay? So first, if you could sit up for me for just some...
Okay.
Okay, all right, perfect. Look up. I'm going to feel your left side. I guess this is your right side first. Okay, I can feel your carotid pulse. It's not thready or weak, and I can establish your pulse rate. Okay, let me feel the right side and the left side now. Okay, the same over here. Her pulse is appropriate rate, and it's not thready or weak, and is normal and easily palpable. I don't see it visually bounding in her neck, so that's a normal finding. Now I'm gonna check your feet. Okay, you can rest your foot right here. Okay, so I can, same down here, feel your pedal pulse. Okay, even with you moving, I can feel your pulse all the way down here. It's normal, same rate that I had up high, higher on your neck, and it's not thready or weak, which is a good sign that your circulation is good down into your feet. Okay, same here on your left side. Perfect.
Good.
And then the last part of your cardiac assessment that involves palpation would be for your PMI, which is at your 5th intercostal space at the mid-clavicular line, and you don't have any lifts or heaves that I was able to palpate. So now I'm going to take a listen to your carotid arteries, so I'm going to help you sit still here just a little bit. So first we're going to do this right side. Okay, so I can easily hear your carotid pulse on this side, normal rate. I don't hear any bruits. Okay, now we're going to do the left side. Same, no bruits upon auscultation. Okay, so next I'm going to perform an assessment on your heart sounds. So I'm going to tell you which ones I'm going to do before I actually listen to them. And I'm going to listen to them both with the diaphragm and the bell of my stethoscope. So if you can just be patient, this will just take a couple of seconds, okay?
It's
So
fine.
first I'm going to listen to your aortic, which is the only side that's on your left. So it's on your left sternal border at the 2nd intercostal space. Then I'm going to move over, move to the right sternal border, staying at the 2nd intercostal space. and I'm going to assess your pulmonic. Then I'm going to go down to the third intercostal space, still on the right sternal border. Listen to Herb's point. Then I'm going to go down to the fourth intercostal space, staying on that right sternal border, and listen to your tricuspid. And then I'm not going to auscultate your mitral, but that is on your the right mid-clavicular line in the fifth intercostal space. Okay, are you ready?
I'm all right.
Okay.
I'm all
You
right.
can just hang
I'm
right
all
like.
right. I'm sorry. I'm
It's
sorry.
okay.
I was falling off the bed.
We're not retaking that
Okay,
because
all right.
it.
It
Okay.
happens. It happens.
Ready?
Okay. Good.
Okay. Okay, I'm just gonna go ahead and come right down here, okay?
That's
You're fine. I just need to work around. She has a deep brain stimulator and has a pacemaker here, so it's a little bit difficult to auscultate all of the areas. I'm gonna listen to the bell for these last two. Okay,
Fine.
you're okay. You're doing great. All right, and then I'm not gonna auscultate the mitral just because of the difficulty of placement for her. Okay, that's it. Thank you. Okay, so just so you know, from your cardiac assessment, everything appears normal. You have a normal rate, normal rhythm, and I don't hear any extra heart sounds or murmurs. Have you had any nausea or vomiting since the last time I saw you last week?
No, I haven't. No.
Okay, well that's very good. Do you remember when your last bowel movement was?
Today.
Okay, this morning, was it normal?
I think so.
The consistency was normal, yes? It was
Yes.
brown in color, not watery or liquidy? Okay,
Right.
that sounds normal. Now I'm going to listen to your abdomen, okay? Is it okay if I go ahead and bring your shirt
Go
up?
ahead.
Okay. If you want to just relax your arms right here.
Okay.
Okay. So first I'm going to listen to her all four quadrants of her stomach for bowel sounds. Is this okay?
It's okay.
No, this isn't too cold.
It's fine.
I can hear bowel sounds in all four quadrants. If I didn't, I would listen for 5 minutes each quadrant that I didn't auscultate bowel sounds. I'm going to listen to her aorta. Normal. Pulse rate. No bruit and no other abnormal findings here. Okay, Ms. Turtzo, now I just want to talk about your urinary symptoms, okay, and do urinary assessment. Have you been noticing any abnormal urinary habits, like increased urinary frequency?
No.
No? Okay. About how many times a day do you urinate?
3 or 4.
Okay, and aren't you taking a medication for your...
My Betrick.
Okay, and how much Mybetriq do you take?
I think it's 50 milligrams.
Okay. All right, so you take 50 milligrams a day at night to help control your urinary frequency?
Now I take it in the afternoon.
Okay, do you feel like that's working for you better than
It's
the
better.
way you took it before?
It's better, yeah.
Okay, are you having to wake up at night at all to use the bathroom?
Yes.
But do you feel like it's improved over when
It
you
has.
were...
It
Okay,
has.
all right, and then any pain when you urinate?
No, none.
Do you notice any discoloration or foul
No,
odor
no.
in your urine?
No.
Okay.
No.
And then if this patient were in the hospital, obviously I would be monitoring her intake and output. But you know, for a home care situation, we wouldn't be doing that. So the first thing I'm going to do, I'm going to test your grip strength. So if you could just sit up for me, please. Good job. Okay, now take my hands with both of your hands at the same time and squeeze my hands as tight as you can. Perfect. Okay, grip strength is about 4 out of 5. Okay, you can go ahead and come back down again. Okay, now is it okay if I take your feet out?
Go right ahead.
Okay, so I want you to push against my foot. Okay, good job. Okay, and then go ahead and push against my foot. So obviously she has some rigidity and some involuntary movements in her lower extremities, but her strength is 5 out of 5. Okay, do you have any numbness or tingling in any of your extremities?
Yes.
Yes, tell me about it.
My fingers.
Your fingers?
I
Okay.
have some numbness.
But is it both sides?
Just one side.
Which side is it?
The right side.
So the right side? So do you have like carpal tunnel syndrome or something else?
It's carpal tunnel.
Okay. But this is nothing new. No, not new since
no.
I've been taking care of you.
No,
This has all been the same way. Okay.
Yes.
So your doctor already knows about this. This wouldn't be a remarkable finding because it's something we already know about Miss Turtzo, that she has extremity numbness and tingling in her hands. Actually, don't I recall you told me you had surgery in your hands?
I did several times. I've had it.
Do you feel like it's better or worse?
It's better, but it's still there.
Okay. That's about it. Thank you so much for letting me take care of you today and come visit you. It's always nice to see you. So as Miss Turtzo's in home, this is her home bed call light if she needs anything. So I'm going to put this right next to you, okay? Her bed, there are no side rails for her bed, but all of her safety measures are in place. She has a walker that we leave close to the bed so she can access it easily. Before I leave, I'll just make sure that all of her accessory items that she needs are within reach and available. Do you want your cell phone just in case you need to make any calls?
That'd be fine.
Okay, so I'll leave your cell phone next to you. Do you need anything to drink, or when is the next time you're going to take your pills?
3 hours.
3 hours from now? Okay. And is there anything else that I can do for you before I go? Looks like you're all set up. Okay. All right. Well, I'm just going to wash my hands and type up my notes, and then we'll plan on seeing you the same time next week, okay?
Be good.
All right. Bye.
Bye.